A critical situation has Lifestar landing.
Looks like you might have a head injury.
An 8-year-old riding a bike struck and dragged by a vehicle.
Ready? 1, 2, 3.
His emergency personnel stabilizing his vital signs.
Easy to bag, no problems, it's good.
Our biggest focus is getting the patient information, as adequate information as possible, getting the patient intubated if they need an airway,
Hey, I've seen it before.
focusing on the major bleeding.
Thankfully, this is just a training session.
Okay, we're holding ceasefire, don't move them.
But it's tough on families who find themselves in this nightmare, watching and praying for a good outcome.
They should keep in mind that we are going to do the best for their child as possible. We're going to keep them comfortable, we're going to keep them sedated, we're going to keep them pain-free, and we're going to concentrate on their injuries.
Next comes the rush into the trauma center. In this case, the simulation center in Hartford Hospital, where a medical team is ready to take over.
Let's roll them, get them off the board.
In the control room,
Patient has blood coming from the left ear.
Blood pressure of 80/40.
Patient also has extremity injuries to the left foot.
Steve Donahue adds more to the scenario.
Pilots get trained on flight simulators, so when something occurs, their training kicks in.
Make sure he's on the monitor.
Now we have the capabilities here with these mannequins and this technology to throw things at them,
Yeah, X-ray.
so we can get their training to kick in when it actually does occur.
Get ready to put a chest tube in.
Okay, chest tube going in on the left.
If they're going to fail, this is the place to fail. If they fail down the trauma room, taking care of a real patient, they'll never live with themselves.
Though not part of this drill, in reality, parents are often allowed inside to comfort the child.
But you have to be careful because you don't want to have the family
We
member
have no movement of his extremities. We're
in the
gonna go to
way of
A
care,
pretty large right cheek laceration.
nor do you want them seeing and doing things which are going to be difficult for the family member.
Can someone call the blood bank, please?
On this day, comforting news for family members.
This is the team ready to go, and they're on. They're on today.
In Hartford, Jocelyn Momenta, News Channel 8.
Children's know that we're going to be going to the pediatric intensive care unit, and we're going to need to put an IC